In 2008, when I started my practice, I had to blaze a few trails when it came to digital dentistry. One of my visions for the way I wanted to practice dentistry was going purely digital, with both X-ray and diagnostic tools, but as well with CAD/CAM technology. And so what I did was I sought out to figure out exactly how to integrate those technologies seamlessly in private practice. And not only just integrate them, but use them to the maximum capacity to implement these technologies the way they were designed to be used from start to finish. And I started that process in 2008. I became very, very close with several large dental manufacturers and became a part of their R&D team, where I was testing and alpha testing and beta testing and working very closely with the engineers to transform the way we're doing dentistry. Not changing the clinical process, but changing the way we integrate these technologies so that we can streamline the workflow for both the dentist and the patients alike. And along that journey, I figured it out. I figured out how to integrate these technologies so that we can utilize them to the benefit of our patients, and certainly to improve the clinical workflow that we all have to face on a daily basis. And soon thereafter, a lot of doctors started asking if I would be willing to help them on their journey as well. And the reality is I really wish that when I started my journey, I had someone to rely on, to lean on, to learn from, and I didn't have that opportunity. So I feel it's a responsibility of mine to share. I'm not a teacher. I'm a wet-fingered clinician, but I love sharing, and that's what I do. So when I teach, I'm actually just showing other doctors how I do it, how it can be done. Certainly there's multiple ways to integrate these technologies, but what I'm really known for is showing doctors how to, on Monday morning, maximize their technology and really, really push the envelope so that they can grow their practices, so that they can actually perform dentistry to a level that they never thought they could. And at the same point in time, grow their businesses where they're bursting at the seams. And that's an awesome experience for me to share those things, because we're doing them every day here in my practice. I'm a wet-fingered clinician, and so the things that I teach, I'm doing on a daily basis. And that's really important, because in the dental industry, we've learned, quite honestly, that there's so many great educators out there, but they've lost touch. They've lost touch of doing daily dentistry, and it's noticeable. It's noticeable to the point where even me, when I attend a seminar, I'm very reluctant and hesitant to learn from somebody, only because what they speak of and what they're teaching, they may have done at some point in their career, maybe 10, 15 years ago, and they're no longer doing it. So I sometimes hesitate to really grasp onto what they're trying to tell me or teach me. To implement it on Monday, it becomes a challenge, because I question whether their techniques are up to date. I question whether they have a real sense of what it's like in this economy with these patients, what these patients have to face on a day-to-day basis, and realize that things have changed in dentistry. So I think that it's important for my students, for my other colleagues, to know that what I present to them, what I share with them, is something that I utilize on a daily basis, and it's working.